Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today we are going to discuss one topic which is the ear pain. Many times in the middle of the night child will have the ear pain and then you have to go to the emergency room, you have to meet the doctor and you have to give some medication to relieve the ear pain. Baby is excessively crying because of the ear pain, mothers are tense. When you go to the emergency room you have to wait for a longer time to see the doctor there. So today we will discuss little bit about the ear pain. First we will discuss about that how is the structure of the ear. Then we will discuss about what are the causes of the ear pain, why the children are getting the ear pain, and then what you can do at home to relieve the children's ear pain. Let's start the video. Friends, first let's see about how is the structure of our ears. So basically what you are saying is this is the outer structure that is known as the pinna. This is known as pinna. This is our external ear. After the external ear we have the small bony tube that is known as the ear canal, and after the ear canal there is a one eardrum. So external ear, the bony tube, then there is the eardrum. After the eardrum we have the small bones which transmits our vibrations from the eardrum and give to the brain, so that we can hear that what sound is produced and we can reply to that sound. So this is the basically the structure of our ear. Now let's see what are the causes why the children are getting the ear pain. So on an average, routinely I am saying routinely, around 80 to 85% of the cases in the children, the ear pain is mainly related with either of the middle ear infection or maybe related to the too hard ear wax. Now what is middle ear? So this is our external ear, then till our tube is there, that is external ear. Eardrum, after the eardrum there is a small space that is known as a middle ear. So the middle ear infection and the ear wax two are the major cause of the ear pain in the children, and many times the ear pain happens in the night. Why it happens in the night, that we will discuss. So now the infection of the middle ear, how the middle ear is getting infected. So this is our external ear, then the tube, then this eardrum. So this is our external ear. Now the middle ear is not in direct contact with our atmosphere, still it is getting infected. How? So there is a one tube known as the eustachian tube. That tube connects our ear to our nose. So there is a one tube which connects from the ear to the nose. So if any child has the recurrent nasal discharge or he has cough and cold, then this tube which connects from the ear to the nose, this nasal portion of that tube is getting blocked. So routinely in this tube there is always a circulation of the fluid. The fluid goes and comes out, fluid goes and comes out. So this is our ear, then tube, then there is the eardrum, then below the eardrum there is a one tube which connects to the nose. So there is a constant drainage of that fluid keeps on happening. So the inner end is getting blocked. That's why what happens, that whatever fluid stays in that tube, that stays for a longer time, and whenever it stays for a longer time it will give a chance of infection. It will give a chance of the middle ear infection. Now once that fluid keeps on getting collected there, this eardrum will start getting stretched. The eardrum has the pain sensation. So once the eardrums start stretching, then the child will start having the pain. So basically what is happening, that because of the nasal block or a prolonged nasal block, the middle like the nasal side of this tube is getting blocked. That's why the fluid keeps on getting accumulated there. As the fluid is getting accumulated, the eardrum will start feeling the stretching sensations, and stretching sensation cause the pain to the child, and that's why the child has the pain. Now why it happens mainly in the night? Because when the child sleeps, so all the jaw structures falls over our nasal tube area. So the tube which is there in the nasal cavity, it is getting blocked mechanically. When the child sleeps, at that time all these our structure falls on it. So that's why this tube is getting blocked. And the chances are more when there is a running nose, cough, cold, because at that time still there is a lot of secretions. So that is causing the blockage of the nasal side of this tube, and that's why the children will have the pain. Now what to do when the pain is there? In the night, child woke up and started crying, holding the ears and crying continuously. What is to be done? So in this type of the situation, our first target is to relieve of the pain. So how we can relieve the pain? So for the pain relief, routinely known as anti-inflammatory medication or the pain relief medications. So which are the pain relief medications? So pain relief medication which we use safely in the children is the ibuprofen. Commonly this is known as a brufen or the neoprofen. So that medicine can be used to relieve the pain. Now what is the dose of this ibuprofen medication? Because if you have seen my videos, I always tell that in the children the medications are based on their body weight. So the dosage of the brufen is 10 milligram per kilogram. So suppose your child is of the body weight 10 kilogram, so you have to give the 100 milligram of the brufen. Now the syrup which is available, brufen syrup, contains 5 ml 100 milligram. So in 5 ml you have 100 milligram. So your 10 kg weight child, you just need to give the 5 ml. And how frequently you can administer it? You can give it 3 times a day if it requires. But this is the emergency solution which you can do at home. Like in the middle of the night the child has the pain, and if you don't want to able to reach to any doctor, or you are not able to go to the doctor immediately, then at home at least you can give 5 ml of ibuprofen, so that his pain will start getting reduced, so he will able to sleep, so that parents also able to sleep. So basically you can use the brufen to reduce the ear pain. Now don't put anything into the ear till it was checked by the doctors, because many times there is habit of the parents to put olive oil or maybe castor oil or maybe some oil drop they put into the ear. But why it is not advisable to do that one? Because you are not knowing what is your situation of your eardrum. Maybe because of the infection, if eardrum has ruptured or the fluid has started coming up, and if you will put the drops, those drops will go into the ear itself, in the middle ear itself, which can seriously damage the organs of the hearing. There are small bones which are help to hear. So that's why we are not advising to put any kind of the oil or any ear drop at home till it is checked by the doctor. So what we have learned today in this video, number one thing, that how is the structure of the ear. So what we are commonly see that this is the ear, but no, ear is more complex structure, because ear is our sensory organ. So sensory organ always have to send the sensation to the brain, and brain has to respond. So that's why this is a very important organ. Second thing, what are the common causes of the ear pain? And what I have discussed today is about the infection of the middle ear, and how you can relieve the ear pain, what you can do at home to relieve the ear pain. Now let's talk about the ear wax. So for the ear wax, I have prepared one detailed video where I have informed you that what kind of the ear drops you can put into the ear, and when the ear wax can be removed, what are the indication of the removal of the ear pain. All those things I have discussed in my previous video, that how to treat the ear wax, or how to remove the ear wax, or how to clean the ear, or how to clean the ear wax. So all those information I have given in 2 separate video. In one video I have mentioned about how to clean the ears, because that was one of the common question asked by the parents, and in the one video I have mentioned it how to clean the ear itself, and how to clean the ear wax also. I have mentioned the name of the few medications, so that you can watch in both of these videos. And nasal clearance is also important, that whenever you have the middle ear infections, basically the reason is the blockage of the inner side of the tube. So nasal clearance by the nasal spray, you can do the normal saline nasal spray in the both the side of the nostril 3 to 4 times a day. So that will help to clear the nasal side of the tube, so that whatever fluid is getting collected, that will start draining through the nose. So that's how child will reduce his pain. So friends, I hope I have narrated the things which is important to you, which is useful to you, and which you can implement at home to help your child when he has the ear pain. If you like this video, you can share this video with your friends, colleagues, newly parents, or whoever wants this kind of the information. You can share this video. If you like this video, you can subscribe as well. If you have any comments, like if you want to know something, or if you want me that the topic on which I can prepare the video, you can put it in the comment box. I will reply on that one, and I will try to give as much useful information to you. All informations which I am giving is mainly the scientifically based or the data based information. We don't want to promote any kind of those informations which are just on the tradition. So all informations will be on the science based and the data based. Thank you very much.